All right, so get this. We're diving into havening techniques today.
Havening technique.
Yeah, you know that thing that sounds kind of like a spa treatment,
Right.
but it claims to like tackle trauma and PTSD.
Yeah.
Pretty heavy stuff. And you sent over a ton of info on it, like their website research papers, even a list of practitioners.
Wow.
And honestly, some of this stuff had my jaw on the floor.
It is pretty remarkable.
Yeah.
The Havening website is very confident.
Yeah.
They're claiming things like instant pain relief
Yeah.
and even memories fading away.
Oh, wait.
Like something out of a sci-fi novel.
Right. They actually say, and I'm quoting here,
Okay.
to Western eyes, to watch pain instantly disappear, long-standing problems resolve, and disturbing memories fade into the irretrievable past is nothing short of astonishing.
Well,
I mean, come on.
it's a bold statement for sure.
It is.
But that's why we're here, right?
Right.
To dig into those claims
Yeah.
and see what's really going on.
Exactly.
Let's start with the basics. What exactly is havening?
Okay, so from what I gathered, it involves using gentle touch, like stroking the arms, face, and hands
Okay.
to calm the nervous system.
Yes.
And they say it can help with a whole laundry list of issues.
Right.
From everyday stress to phobias and even, as we said, PTSD.
Exactly. And the idea is that this touch, combined with specific protocols, can actually create delta waves in the brain.
Delta waves.
Yeah.
Now, those sound familiar, but remind me, what are they all about?
Think about that feeling of deep relaxation,
Okay.
like right before you fall asleep.
Okay.
That's when delta waves are most prominent.
Okay.
They're associated with a sense of calm safety and even pain relief.
So havening is like manually shifting your brain into chill mode.
Yeah.
I'm starting to see why this is so intriguing.
Absolutely.
Yeah.
And some of the research on havening, although still in its early stages,
Okay.
is starting to explore this connection between touch delta waves and therapeutic outcomes.
You mentioned research. The Havening website does have a section dedicated to studies
Right.
that they say support their claims.
Okay.
One that caught my eye was about the mutability of type D personality.
Oh, interesting.
Now, if I remember correctly,
Yeah.
type D folks are prone to negative emotions and tend to suppress them.
Right.
Not the happiest bunch.
That's right.
No.
And what's fascinating about this study is that it suggests that even deep-seated personality traits might be more changeable than we previously thought.
Wait, hold up. Are you saying personality isn't completely set in stone?
That was a huge deal.
It is. And in this study, havening was used as part of a broader intervention
Okay.
that resulted in a significant decrease in type D characteristics among the participants.
Wow.
They actually measured things like negative affectivity and social inhibition.
So they weren't just feeling better subjectively.
Right.
There were actual measurable changes.
Yeah.
That's impressive.
It is promising.
Yeah.
Of course, this is just one study.
Right. And we need more research to confirm these findings.
Of course. Yeah.
But it definitely opens up some exciting possibilities.
All right, so color me intrigued, but still a bit skeptical.
Okay.
What about the study on augmenting resilience to trauma?
Yeah.
That one sounds particularly relevant these days.
Yes, absolutely.
Yeah.
That study explored how havening might help individuals cope with traumatic experiences.
Okay.
And the findings were quite interesting. They
Right.
found that using havening techniques led to a significant reduction in PTSD symptoms.
Hold on, so they saw a real decrease in PTSD symptoms after using havening.
Yeah.
How did they even measure something like that?
Well, they used standardized questionnaires and clinical interviews to assess PTSD symptoms,
Okay.
like flashbacks, nightmares, and emotional distress.
Okay.
And they found that the group that received havening showed significant improvement compared to the control group.
Okay, now that's what I'm talking about.
Yeah.
Real data.
Real data.
If this holds up, it could be a game changer for people struggling with trauma.
It could indeed. And what's particularly interesting is that they also measured cortisol levels,
Cortisol.
which is a key stress hormone.
Okay.
And guess what?
Right.
The havening group showed a decrease in cortisol,
Really?
suggesting a physiological response to the technique.
So it's not just about feeling calmer.
Yeah.
It's actually impacting the body's stress response system.
Exactly.
Ugh.
It seems. Havening might be tapping into something deeper than just surface-level relaxation.
Oh, wow.
But as always, more research is needed to really understand the mechanisms at play.
Fair enough. I'm definitely hooked.
Okay.
But I also know that we need to approach this with a healthy dose of skepticism.
Right.
What are some of the limitations of the research that we should keep in mind?
That's an excellent point.
Yeah.
While these studies are encouraging, it's important to remember that the current body of research on havening is still relatively small.
Okay, so we can't just take these early findings as the final word.
right? We need more large-scale studies with diverse populations to confirm these initial results.
Uh-huh.
And it's also important to remember that scientific research is a process,
Yeah.
and it takes time to build a solid foundation of evidence.
So we need to be cautiously optimistic, right?
Exactly. It's like putting together a puzzle.
Okay.
We have some intriguing pieces, but we need more to see the full picture.
All right, fair enough. I'm ready to keep digging.
Okay?
Now that we have a handle on the basics and have
Right.
seen some of the promising research,
Uh-huh.
I'm curious about the technique itself.
Okay.
How does this whole heavening touch thing actually work?
Well, as we mentioned earlier, it involves gentle stroking on specific areas of the body,
Right.
like the arms, face, and hands.
Right. But how does that stroking create those delta waves and all the positive effects we've been talking about?
That's where things get a bit more complex.
Okay.
And honestly, there's still a lot we don't know,
Okay.
but there are some interesting theories.
Okay. Lay it on me. I'm ready to go a little deeper.
Well, one theory is that the havening touch activates certain nerve endings
Okay.
that send calming signals to the brain.
Uh-huh.
It's almost like disrupting the stress response by flooding the system with these calming sensations.
So it's like overriding the panic button with a wave of relaxation.
Yeah,
I kind of like that image.
it's a good analogy. And another theory involves something called amygdala depotentiation.
Amygdala depotentiation.
So stick with me here.
Right.
It sounds complicated, but it's actually pretty straightforward.
All right, I'm all ears.
The amygdala is a part of the brain
Okay.
that plays a key role in processing emotions, especially fear and anxiety.
Right.
And the theory is that havening helps to depotentiate the amygdala,
Depotentiate.
meaning it reduces its activity.
So essentially calming down the brain's alarm system.
That makes sense.
Yeah.
Exactly. And this could explain why havening seems to be effective for issues like phobias and trauma,
Mm-hmm.
which are often rooted in fear and anxiety.
I see where you're going with this, and it all ties back to those delta waves, right?
Right.
By calming the amygdala and activating those calming nerve endings,
Yeah.
we're essentially shifting our brain into a more relaxed state.
Precisely. And it's that shift in brain activity that may be the key to unlocking havening's therapeutic potential.
All right, so we've got the basics, the research,
Right.
and now the theory behind the technique.
Mm-hmm.
But I'm curious, how do they actually put this into practice?
Well, there are specific havening protocols
Okay.
that are designed to address different issues.
Okay.
For example, there's a protocol for addressing generalized anxiety,
Uh-huh.
one for phobias,
Okay.
and another for processing traumatic memories.
So it's not just a one-size-fits-all approach.
No, it's tailored to the individual's needs and the specific issue they're seeking help with.
Okay, so how do these protocols differ? Give me an example.
Let's take the protocol for phobias, for instance.
Right.
It typically involves first identifying the specific phobia and the associated feelings and sensations.
Right, because you need to know what you're dealing with before you can start tackling it.
Exactly.
Mm-hmm.
Then the practitioner will guide the individual through the havening touch,
Okay.
focusing on those areas of the body that are most responsive to calming sensations.
Okay, so that's the actual stroking part.
Right.
But there's more to it than just that, right?
Right. While the individual is receiving the havening touch, they're also guided through a series of visualizations and cognitive exercises
Okay.
designed to interrupt the fear response
Uh-huh.
and create new positive associations.
So it's a combination of physical touch and mental reframing.
Yeah.
It almost sounds like a form of exposure therapy, but with a much gentler approach.
That's a good observation.
Yeah.
It does share some similarities with other therapies.
Okay.
But havening's unique combination of touch, visualization, and cognitive techniques seems to create a powerful synergistic effect.
Okay, so they're calming the nervous system with the touch. And then using visualization and mental exercises to kind of rewire those fearful associations.
Exactly.
I can see how that would be effective.
And it's important to note that havening is often used in conjunction with other therapeutic approaches,
Right.
not necessarily as a standalone treatment.
Right. It's all about finding what works best for each individual.
Exactly.
Now, speaking of individuals, you sent over a list of certified havening practitioners.
Yes.
And I have to say, I was surprised by how many there are.
Yes, havening has gained a lot of traction in recent years.
Wow.
And there's a growing network of practitioners worldwide.
And there are even online options available,
That's right.
which is great for accessibility.
Yeah.
But with so many practitioners out there, how do you know who to choose?
That's a great question, and it's one we'll definitely delve into further in the next part of our deep dive.
Okay.
We'll talk about how to find a qualified practitioner,
Okay.
the importance of feeling comfortable and safe,
Yeah.
and even some of the ethical considerations to keep in mind.
Sounds good. But before we get ahead of ourselves,
Yeah.
I've got one more question about the technique itself.
Okay.
I came across something called the SUDS scale on the Havening blog.
Oh, yeah.
Apparently, it stands for Subjective Units of Distress.
Ah, yes, the SEDS scale.
SUDS scale.
It's a simple but effective tool used in many therapeutic settings,
Okay.
including havening.
So how does this SUDS thing work, and why is it important in havening?
Well, it's essentially a way for individuals to rate their level of distress
Okay.
on a scale from 0 to 10.
Okay.
Before a havening session, the practitioner might ask,
Yeah.
on a scale of 0 to 10, with 0 being completely relaxed and 10 being the most distressed you've ever felt, where are you right now?
So you're basically checking in with yourself and gauging your current level of, I need a hug.
Exactly. And then after the havening session,
Right.
they'll ask you to rate your distress level again.
Okay.
This helps to track progress and see if the havening techniques are having a positive impact.
That makes sense. It's a way to quantify those subjective feelings.
Right.
And see if there's been a tangible shift.
Exactly.
I like that it's incorporating the individual's own experience into the process.
Absolutely. It's all about empowering individuals to understand and manage their own emotional states.
It's fascinating stuff. We've covered so much ground already, but I feel like we've just scratched the surface.
You're right. There's still so much more to explore.
Well, before we move on, let's take a quick recap.
Okay.
We started by looking at the basic concept of havening,
Right.
using gentle touch to calm the nervous system
Uh-huh.
and address a wide range of issues.
A whole laundry list.
Then we dove into some of the intriguing research,
Right.
exploring how havening might change personality traits
Yeah.
and even reduce PTSD symptoms.
Very interesting stuff.
And we unpacked the theory behind the technique,
Mm-hmm.
discussing how havening touch might create delta waves,
Right.
calm the amygdala,
Yeah.
and ultimately lead to a state of deep relaxation.
Exactly.
And finally, we touched upon the practical application of havening, exploring the different protocols
Right.
and the use of the SUDS scale to track progress.
Mm-hmm.
Wow, it's
Yeah.
amazing how much we've covered already.
I know, right?
And yet there's still so much more to discover.
Indeed. In the next part of our deep dive,
Okay,
we'll delve into the world of havening practitioners,
right.
exploring how to find the right one for you,
Okay.
the ethical considerations involved,
Uh-huh.
and even some of the potential risks and benefits.
It sounds like we're just getting started. Stay tuned, folks,
Yep.
because this havening journey is about to get even more interesting.
I can't wait. So as promised, let's dive into the practical side of havening.
Okay.
We've talked about the science and the theory,
Right.
but what about actually finding a practitioner
Yeah.
and trying this out for yourself?
That's a great point. You sent over a list of certified practitioners.
Yeah.
And it seems like havening is available all over the world,
It is.
even online.
That's right.
But with so many options, it can be kind of overwhelming to know where to start.
Right.
What advice would you give our listener who's thinking, okay, I'm intrigued. What's next?
First and foremost, I'd say don't rush into anything.
Okay.
Take your time to research different practitioners and find one who resonates with you. It's a very personal choice,
Right.
and feeling comfortable and safe with your practitioner is absolutely essential.
That makes total sense. It's like choosing any other healthcare provider.
Right.
You want someone you trust and feel good about working with.
Exactly.
But what should our listener be looking for specifically when researching practitioners?
Yeah,
Are there any red flags to watch out for?
absolutely. The first thing I'd recommend is checking their credentials.
Okay.
Are they certified by a reputable havening training organization?
Okay.
The official havening website has a directory of certified practitioners,
Uh-huh.
which can be a good starting point.
All right.
You want to make sure they have the appropriate training and experience
Okay.
to address your specific needs.
Okay, so credentials are key.
Hmm.
What else should our listener keep in mind? What about their approach or style? Does that matter?
It absolutely does.
Yeah.
Havening is a very gentle and collaborative approach.
Right.
So you'll want a practitioner who is patient, empathetic,
Yeah.
and skilled at creating a safe and supportive environment.
I imagine it would be pretty uncomfortable to open up about trauma or deep-seated fears with someone who isn't sensitive and understanding.
Exactly. And remember, this is about your healing journey.
Yes.
You have the right to ask questions,
Uh-huh.
express your concerns,
Okay.
and even stop a session. if you're feeling uncomfortable for any reason.
Yeah.
A good practitioner will respect your boundaries
Okay.
and work with you at your own pace.
That's reassuring to hear.
Good.
Now, I know we touched on this briefly earlier, but let's talk about the ethical considerations involved in havening.
Okay.
Are there any potential risks or concerns that our listeners should be aware of?
That's an important question.
Yeah.
While havening is generally considered a safe approach,
Uh-huh.
there are a few things to keep in mind. Firstly, it's crucial to understand that havening is not a replacement for traditional therapy or medical treatment.
Right. It's not a magic bullet,
You know,
and it's not going to cure everything.
it's a complementary approach
Right.
that can be used alongside other forms of care
Uh-huh.
and for individuals with serious mental health conditions.
Yeah.
It's especially important to work with a qualified practitioner
Okay.
who is experienced in addressing those specific issues.
So if someone is struggling with severe trauma, for example,
Yeah.
it's not something to just try on your own.
Not necessarily. While havening techniques can be helpful for managing stress and anxiety,
Okay.
working with a trained professional is crucial when dealing with complex trauma.
Right.
They can assess your individual needs,
Yeah.
tailor the approach accordingly,
Uh-huh.
and provide the necessary support and guidance.
That makes sense. What about potential side effects? Are there any?
Havening is generally considered to have minimal side effects.
Hmm.
Some people might experience temporary emotional release during or after a session,
Uh-huh.
such as crying or feeling overwhelmed,
Okay.
but a skilled practitioner will be able to guide you through those experiences safely and supportively.
Okay, so it's not uncommon to have some emotional ups and downs,
Right.
but it's all part of the process.
That's part of the process.
Anything else our listeners should keep in mind regarding ethical considerations?
One thing to be mindful of is the potential for power dynamics.
Okay.
In any therapeutic relationship,
Yeah.
it's important to choose a practitioner who respects your autonomy,
Uh-huh.
doesn't make promises they can't keep,
Right.
and avoids any kind of coercive behavior.
Right. It should be a collaborative and empowering experience,
Yes.
not one where the practitioner has all the power
Right.
and the client feels pressured or manipulated.
Exactly. And if something doesn't feel right,
Yeah.
trust your instincts and don't hesitate to seek a second opinion
Okay.
or find a different practitioner.
So it's all about finding the right fit, feeling safe and respected,
Yes.
and knowing that you have choices.
Precisely. Now, I know we've talked a lot about the potential benefits of havening,
Yeah.
and the research certainly seems promising,
Uh-huh.
but I think it's also important to acknowledge that not everyone will experience the same results.
Right. It's not a one-size-fits-all solution.
Right.
And what works for one person might not work for another.
Exactly. Individual responses to havening can vary,
Okay.
depending on a range of factors, such as the nature of the issue,
Uh-huh.
the individual's personal history,
Right.
and their overall level of self-awareness.
Okay, so it's not a magic cure,
No.
and it's not going to work miracles overnight.
It's important to manage expectations.
Yeah.
Havening is a process, and it takes time, commitment, and a willingness to engage with the techniques to see lasting results.
And it's probably not for everyone, right?
Right.
Some people might prefer other approaches like traditional therapy or medication.
Absolutely. It's all about finding what works best for you.
Yeah.
And I think that's one of the great things about the field of mental health and well-being.
Mm-hmm.
There are so many different options available.
It's like a buffet of healing modalities.
I like that.
You can pick and choose what resonates with you
Yeah.
and create a personalized approach that meets your individual needs.
I love that analogy. And speaking of personalized approaches,
Yeah.
let's circle back to that online intro event you mentioned earlier.
Yes.
It seems like a great way for our listener
Mm-hmm.
to get a taste of havening
Yes.
without having to commit to a full session.
Yes, it's on February 12th with Mark Wainfield,
Okay.
who's been a havening trainer since 2014.
Wow.
He's going to be talking about the basics of havening, how it works, and its potential applications.
That sounds like a fantastic opportunity
It is.
to learn more and see if havening might be a good fit for you.
Yes.
And it's online, so you can attend from the comfort of your own home.
Exactly. No need to even put on pants.
That's right.
But in all seriousness, I think it's a great option for anyone who's curious, but not quite ready to dive in head first.
It's a low-pressure way to explore the world of havening
Right.
and see if it sparks your interest.
So to recap for our listener, if you're thinking about trying havening,
Yeah.
start by doing your research, find a qualified practitioner who resonates with you, understand the ethical considerations,
Right?
and manage your expectations.
Good advice.
And if you're still on the fence, Check out that online event on February 12th. It
Definitely.
could be the perfect way to dip your toes into the water
Yeah.
and see if havening is something you want to explore further.
Now, I know we've covered a lot of practicalities,
We have.
but I want to circle back to the bigger picture for a moment.
Okay.
This whole idea of using touch to heal and transform is pretty profound, don't you think?
It really is. Touch is such a fundamental human need.
It is.
And yet we often underestimate its power.
We do.
It's true. We hug our loved ones, we hold hands, we get massages, but we rarely think about touch as a potential tool for addressing deep-seated emotional issues.
And that's what's so fascinating about havening.
I know, right?
It's taking something as simple and natural as touch
Yeah.
and using it in a very intentional and therapeutic way.
It's almost like rediscovering the healing power of human connection.
Exactly. And it challenges us to think about the mind-body connection in a whole new way. Havening is based on the idea that our physical sensations,
Right.
our emotions, and our thoughts are all interconnected.
So it's not just about treating the symptoms,
Right.
it's about addressing the root cause on a deeper, more holistic level.
That's the key, and I think that's why havening is resonating with so many people.
Yeah.
It offers a gentle yet powerful approach to healing that acknowledges the interconnectedness of our being.
I'm really struck by this idea of using touch to create safety and calm,
Yeah.
especially in a world that can feel so chaotic and overwhelming.
Like creating a sanctuary within ourselves.
Yeah.
A place where we can feel grounded, secure, and capable of healing.
And to think that something as simple as stroking the arms or face
Yeah.
could have such a profound impact on our nervous system
I know.
and our emotional well-being is pretty mind-blowing.
It is. It speaks to the incredible plasticity of the brain.
Yeah.
And our innate capacity for healing and transformation.
I'm starting to see why you were so fascinated by this topic when we first started talking about it.
Yeah.
It's much more than just a technique. It's a whole new way of thinking about healing and well-being.
I completely agree. And I think that's what makes this deep dive so intriguing.
Uh,
We're not just exploring a technique.
yeah.
We're exploring a new paradigm of possibility.
And who knows, maybe with further research and understanding,
Right.
havening will become a more widely accepted and integrated approach to mental health and well-being.
Imagine the implications if we could harness the power of touch to help people overcome trauma, manage stress, and live more fulfilling lives.
That's a powerful thought to leave our listener with as we wrap up this part of our deep dive.
Indeed. And in the final part, we'll delve into some of those potential implications and explore what the future might hold for havening and the field of touch-based therapies.
So we've explored the science, the technique, the practicalities of finding a practitioner, and even touched on some of the ethical considerations.
There's a lot of information.
But now I'm really curious about the bigger picture. Like, what does all of this mean for the future of mental health and well-being?
That's a great question. And I think havening has the potential to really shake things up.
In what way?
Well, if the research continues to support its effectiveness, it could become a much more mainstream approach to addressing a wide range of issues.
Like, imagine a world where touch-based therapies like havening are as commonplace as talk therapy or medication.
Right.
It's a pretty radical shift from the way we currently view mental health care.
It is. Havening challenges us to think beyond the traditional model of mental health treatment,
Yeah.
which often focuses on analyzing thoughts and behaviors.
Right.
It brings the body back into the equation, acknowledging the powerful connection between our physical sensations, our emotions, and our overall well-being.
And it's so simple, yet so profound. It's almost like we've forgotten the innate healing power of human touch.
Exactly. We've become so accustomed to addressing mental health challenges through cognitive or pharmaceutical interventions
Right.
that we've overlooked the potential of something as basic and fundamental as touch.
It's like we've been missing a crucial piece of the puzzle all along.
And I think havening is reminding us that healing isn't always about complex theories or elaborate techniques.
Uh-huh.
Sometimes it's about tapping into our innate capacity for self-regulation and connection through simple yet powerful means.
Yeah, it's almost like a return to our roots, to a more intuitive and embodied understanding of healing.
Exactly. And if we can embrace this more holistic perspective,
Yeah.
I think it could have a ripple effect throughout the entire field of mental health care.
So instead of just treating the symptoms, we're actually addressing the underlying causes
Right.
on a deeper, more integrated level.
Precisely. And I think this shift in perspective could lead to more preventative approaches to mental health,
Okay.
empowering individuals to manage stress and cultivate well-being before issues become chronic or debilitating.
It's like shifting from a disease model to a wellness
Oh,
model.
that's a great way to put it. And imagine the implications for trauma recovery.
Trauma recovery.
If havening can help individuals process and release traumatic memories in a safe and effective way,
Uh-huh.
it could revolutionize the way we approach PTSD and other trauma-related conditions.
It could be a game changer for veterans, survivors of abuse, first responders,
Wow.
anyone who's experienced a significant traumatic event.
Absolutely. And it could also have profound implications for addressing societal issues
Like what?
like violence addiction and even intergenerational trauma.
Whoa, now we're really getting into the big picture
I
stuff.
know, it's pretty amazing.
It's amazing to think that something as simple as touch could have such far-reaching consequences.
It's a testament to the power of human connection and our innate capacity for healing.
Now, I know we've been talking about the potential benefits of havening, but I think it's also important to acknowledge that there's still a lot we don't know.
Right.
The research is still in its early stages, and more studies are needed to confirm its long-term effectiveness.
You're absolutely right. We need to approach havening with cautious optimism, embracing its potential while remaining grounded in scientific rigor.
And it's important to remember that havening isn't a magic cure-all.
Right.
It's a tool, and like any tool, it needs to be used appropriately and ethically.
Exactly. And that's why it's crucial to choose a qualified and experienced practitioner
Yeah.
who can guide you through the process safely and effectively.
It's also important to remember that havening isn't for everyone. Some people might prefer other approaches,
Right.
and that's perfectly okay. The key is to find what works best for you on your individual healing journey.
Absolutely. And as with any new approach, there will always be skeptics and critics.
Oh, yeah.
That's healthy and necessary. It forces us to keep asking questions, refining our understanding, and ensuring that we're using havening in a responsible and ethical way.
Okay, so we've covered a lot of ground today. We've explored the science, the technique, the practicalities, the ethics, and even the potential implications for the future. But before we wrap up, I want to circle back to our listener who's been patiently following along on this havening journey.
Yeah, what a journey.
What would you say to them as they contemplate all this new information and decide what to do next?
I'd say first and foremost, trust your instincts.
Yeah.
If you're intrigued by what you've heard, do your own research, explore those resources we mentioned,
Uh-huh.
and maybe even attend that online intro event with Mark Wingfield on February 12th.
Yeah, that's a great idea.
It's a great opportunity to learn more from an expert and get a feel for whether havening might be a good fit for you.
And if you decide to try havening,
Yeah.
remember to find a qualified practitioner who resonates with you, someone who you feel comfortable and safe with. And most importantly, approach this with an open mind and a sense of curiosity.
Yeah.
Havening might not be the answer for everyone, but it presents a fascinating possibility for healing and transformation.
It really does.
It's like opening a door to a whole new world of understanding about the power of touch, the mind-body connection, and our innate capacity for well-being.
So well said.
So as we wrap up this deep dive into the world of havening techniques, we encourage you to keep exploring, keep questioning, and keep seeking out those approaches that resonate with your heart and your mind.
And remember, the most important journey is the one you take within yourself.